Understanding stroke risk factors and types. Welcome. Today, we'll explore crucial stroke risk factors and types you need to know. Hypertension is a leading risk factor for stroke, causing carotid artery damage. Atrial fibrillation creates turbulent blood flow, increasing stroke risk through thrombus formation. Even with both conditions, atrial fibrillation is a bigger risk factor for stroke. Anterior cerebral artery stroke can lead to motor and sensory issues in the contralateral leg. Middle cerebral artery strokes cause motor and sensory deficits in the contralateral arm and face. A stroke in the posterior cerebral artery can lead to homonymous hemianopsia and face recognition issues. Wallenberg syndrome results from a stroke in the posterior inferior cerebellar artery, causing dysphagia. Medial medullary syndrome leads to ipsilateral tongue deviation from a stroke in the anterior spinal artery. Lateral pontine syndrome, or ICA stroke, results in Bell's palsy affecting facial mobility. Weber syndrome presents with ipsilateral CN3 palsy and contralateral weakness. Lockton syndrome causes total body paralysis, except for eye movement, after a basilar artery stroke. Gerstmann syndrome involves agraphia, acalculia, finger agnosia, and left-right disassociation. Hemibolismus results from subthalamic nucleus stroke, causing violent arm or leg movements. Lacunar infarcts arise from hypertension, causing necrosis in small brain vessels with distinct syndromes. Charcot-Bouchard microaneurysms can lead to hemorrhagic strokes and intracerebral bleeds. Liquefactive necrosis and red neurons indicate acute ischemic infarction in the nervous system. Wallerian degeneration describes the degeneration of axons after injury, impacting regeneration. Subclavian steal syndrome occurs from subclavian artery stenosis, causing dizziness and blood pressure differences. Diagnosis often involves comparing blood pressure in both arms and imaging like CT angiography. Vertebral artery stenosis also causes dizziness but without differences in arm blood pressure. Dissection in the vertebral artery can produce clots leading to strokes, especially after neck manipulation. Wernicke's aphasia enables fluent speech that's nonsensical, affecting comprehension and repetition. Broca's aphasia leads to non-fluent, telegraphic speech and frustration due to communication barriers. Conductive aphasia is characterized by impaired repetition while other speech abilities remain intact. Global aphasia merges symptoms of both Broca and Wernicke's aphasia with impaired repetition. Transcortical sensory aphasia mirrors Wernicke's but preserves the ability to repeat spoken phrases. Transcortical motor aphasia presents similarly to Broca's but with intact repetition capability. For ischemic strokes, non-contrast CT is vital to distinguish them before administering TPA. In hemorrhagic strokes, rapid blood pressure management is key, avoiding TPA. Rapid sodium correction may lead to severe neurological complications like cerebral edema. Hypercalcemic crises cause delirium due to high calcium levels. Normal saline is the initial treatment. Pseudotumor cerebri occurs without clear structural causes, often linked to obesity and contraceptives. Ray syndrome causes severe complications like hepatic issues and cerebral edema from aspirin use in children. Diffuse axonal injury from acceleration-deceleration trauma often results in comatose states. The spinothalamic tract conveys pain and temperature sensations from the contralateral body. The corticospinal tract controls motor functions. Damage leads to ipsilateral loss of movement. Dorsal columns are responsible for proprioception. Lesions can cause ataxia and positive Romberg tests. Upper motor neuron lesions show hyperreflexia, while lower motor neuron lesions present with weakness. Tabes dorsalis results in loss of proprioception and vibration sense, often causing ataxia. Syringomyelia causes bilateral pain and temperature loss due to anterior white commissure lesions. Brown-Sequard syndrome showcases ipsilateral motor and sensory loss alongside contralateral pain loss. Transverse myelitis causes variable deficits often stemming from viral infections or autoimmune disorders. Central cord syndrome typically presents greater weakness in upper limbs, often from neck injuries. Anterior cord syndrome retains vibration, proprioception while losing motor and pain, temperature functions. Thank you for watching. Explore more about strokes and stay informed.